Bethell.
Thank you, Chair. Lord Bishop, when the government first announced the £11 million for a centralised app, there was many people, programmers, etc., who were very clear that a centralised app wouldn't work because it wouldn't have the buy-in from the public to download. It was clunky and cumbersome, and no other country had a centralised app. What app are we currently talking about now, just for people who are tuning in?
Sure. Well, you are right that the early stages of our app development, we learnt a huge amount doing it. There was a lot of comment at the time that we needed to take a different approach, and we learnt from that, and we have taken a different approach. And this is a decentralised app of the kind that you allude to, and there are benefits to that. One principal benefit is consumer confidence. The consumer can rightly believe that their data is secure on the device, that it's very heavily protected, and that they can carry this app in the full confidence that it is fully private and held by them and them alone.
Do you think we needed to spend £11 million to get to that conclusion?
I think that there were really good reasons for going down that route. They were mainly epidemiological. The benefits of going down the centralised route is that we got a lot of data, and it was at a time when we didn't have any data at all. We now have REACT and ONS. We have a phenomenal amount of epidemiological insight every week coming in our surveys, so we know a lot more about the spread of the disease. Earlier in the year, we were flying completely blind, and therefore the emphasis on getting that data in was much, much stronger. Now that we have that other data, it is less of a priority.
Okay, thank you. What has the uptake been on the app?
That one I will refer to Simon Townsend for. Simon, would you like to take that one?
Yeah, we've been very, very encouraged. I think we did 3 areas that we did some testing in. We went to the Isle of Wight, we went to NHS volunteers up and down the country, and also to Newham. I think for those people that may well not know, particularly the Isle of Wight and Newham, they are a very, very different reality in terms of the population and how they move and their age and their demographics. So we were really keen to see that. What I would say is that having visited both of the areas very, very recently and spoke to the local team that have done awesome support in terms of helping us out here, is that, the adoption has been very encouraging. I think Isle of Wight in particular, on the grounds that it was the second time that we went back to the Isle of Wight, I think it was fair to say, and I looked from my own perspective, that we thought, well, let's see if people are happy to go a second time around. And actually, they were. They were very happy to do that. And in terms of Newham as well, by working with the local authorities who did a super job, again, we've learned many things there in terms of how it is we can encourage uptake. But I think the overall message is we should definitely be encouraged based on our learnings, both in the Isle of Wight and in Newham and in NHS volunteers. And I'll say it again, there are differences between Newham and the Isle of Wight, and the adoption has been very encouraging and the learnings have been invaluable.
Thank you. Are you going to publish the assessments of the Newham and Isle of Wight?
Yes, we've always said that all of our evaluations will be published. We always said that it would be as soon as practical after our launch, and we are planning to launch next week.
Okay, great, thank you. And just, Chair, if I may, just very quickly to Baroness Harding, I hope this is helpful with Graham's earlier question, just to say that the government's flagship NHS test and trace system missed its key targets 9 weeks running, and Serco obviously missed its targets, and it was quite a surprise to people that they actually had their contract renewed, because they were paid £192 million to provide 18,500 call handlers and local authorities. It's another case, actually, of the government trying to have a centralised approach as opposed to a decentralised approach, which would have been more effective. But I hope that's helpful.
To briefly respond, Baroness Harding?
Very briefly, we have a local and a national approach rather than a centralised one. We've doubled the number of people working in local health protection teams over the last 4 months, and we are continuing to recruit and expand. We work hugely closely with the Public Health England health protection teams as part of an integrated tracing system, which does have national, of course, the temptation to describe them as national. Actually, these are people working in their homes, in their kitchens, in their studies, calling people who are at risk of infecting their loved ones. And Serco and Cytel and NHS professionals who together stood up the national contact tracing, stood that service up in the space of 3 weeks, and have, as I said earlier, between now and then contributed to us contacting over 400,000 people. So I don't think that is a failing service at all. That's something that's delivered on exactly what it said it would do.